Yes, pyelonephritis. So first we see the definition. What is pyelonephritis? So pyelonephritis is the inflammation of tubules plus interstitium plus renal pelvis. So pyelonephritis is the inflammation of tubule, interstitium and renal pelvis, or simply it is known as inflammation of the kidney. Okay, so the term pyelonephritis is of two types. Pyelonephritis is of two types. It can be either acute, it can be chronic. So first we see the acute pyelonephritis. So as we know that the acute pyelonephritis means for a short period of time, and chronic is for a longer duration or something spread along with the various diseases. So acute pyelonephritis. What is the etiology of acute pyelonephritis? Etiology is urinary tract infection, that is UTI. But as we know, UTI is of two types, ascending and descending. UTI is of two types, ascending and descending. So mainly ascending UTIs. And second is the hematogenous spread. Second is the hematogenous infection. Second is by hematogenous infection. So we see the definition of pyelonephritis, and pyelonephritis is of two types, acute and chronic. What is the etiology of acute pyelonephritis? Is first is UTI, ascending urinary tract infection, and then second is the hematogenous infection. Okay, so what is hematogenous infection? Hematogenous infection are the infection which comes from the blood, means blood-borne infection. What? Blood-borne infection. Okay. So what are the causes of UTI? What are the causes of UTI? The causes can be caused by the bacteria. Bacteria may be E. coli, Klebsiella, protease. It can be Pseudomonas. So UTI is the most common cause of UTI is the E. coli. Okay, so ठीक है. And what are the complications associated with acute pyelonephritis? Complications are 3 P's, that is papillary necrosis, and pyonephrosis and perinephric abscess. So these are the 3 complications: papillary necrosis, pyonephrosis and perinephric abscess. So we end the acute pyelonephritis. Now chronic pyelonephritis. So here we will start with the chronic pyelonephritis. Chronic pyelonephritis. So what is the etiology of chronic pyelonephritis? Etiology, it is secondary to any obstruction. Obstruction in what? Obstruction, it may be either in the ureter or at the pelvis or in the urinary bladder or at the level of the urethra. And due to this obstruction by vesico-urethral reflex. These are the So what is vesico-urethral reflex? Vesico-urethral reflex, let us, these are the two kidneys, these are the ureters, and these are the ureters, and this is the urinary bladder, and this is the urethra. So the obstruction can be caused by any renal calculi. Obstruction caused by renal calculi. So whenever maybe at any place, let us assume that here is a renal obstruction by a renal calculi. So from here a reflex goes to the kidney. At this level we so from here goes to the kidney, a reflex goes to the kidney. So this reflex is known as vesico-urethral reflex. So what are the findings in the chronic pyelonephritis? So what is the microscopy? माइक्रोस्कोप एग्जामिनेशन में क्या मिलेगा हमें क्रोनिक पायलोनेफ्राइटिस में? आउट पाउचेस ऑफ द ट्यूब्यूल. When we look in the microscope tubules of the kidney, it is out pouches of the tubules, and there is resemblance like thyroid follicle. Tubules resembles like thyroid follicle. This is known as thyroidization of tubules. And what is the morphology? What is the morphology in chronic pyelonephritis? So in morphology we see xanthogranulomatous pyelonephritis, and large yellow nodules on kidney. So this is the pyelonephritis. So we will look at this pyelonephritis. So this pyelonephritis, overall definition: inflammation of the tubule, interstitium and renal pelvis. Pyelonephritis is of two types, acute and chronic. What is the etiology of acute pyelonephritis? That is UTI, ascending urinary tract infection, hematogenous infection. Hematogenous infection means blood-borne infection. UTI is caused by bacteria, or maybe some other microbacterial such as virus, or it may be also fungi, but commonly caused by the bacteria. Following bacteria cause UTIs. इन बैक्टीरिया में से भी जो E. coli होता है मोस्ट कॉमन कॉज होता है. What are the complication of the acute pyelonephritis? That is the papillary necrosis, pyonephrosis and perinephric abscess, pneumonic 3 Ps. And this is the acute pyelonephritis, and then chronic. So this is the chronic pyelonephritis. What is the etiology? Secondary to the obstruction, vesico-urethral reflex. What is vesico-urethral reflex? Whenever there is obstruction at any level in the pathway of the urination, there is reflex goes to the kidney. This is the vesico-urethral reflex. What is the morphology? Xanthogranulomatous pyelonephritis and large yellow nodules on the kidney. Microscopy is the out pouches in the kidney, resemblance like the thyroid follicle, means thyroidization of the tubule. And this overall pyelonephritis is this. And what are the symptoms in the patients of pyelonephritis? So pyelonephritis patient symptoms are, what are the symptoms come in the patients of pyelonephritis? That is, whenever there is an infection, there is a fever, there is pain, malaise, dysuria. Dysuria means pain during urination. So these are the various symptoms. These symptoms come in the patients of pyelonephritis.